Hi, it's Jenny and friends, and Dr. Kohli with us again, the 9 News medical expert, Harvard educated. She's an associate professor for, like Duke and Johns Hopkins. She also has Cherry Creek Heart, her own clinic or practice, if you will, in Aurora. So thank you for coming on today. We wanted to talk about, this is something I don't think a lot of people know, menopause versus menopause. Like there are two completely different, entities.
Right. So most of us know menopause, right?
Mm-hmm.
It's a phase in every woman's life where her reproductive cycle sort of pauses. Her ovaries turn off. Usually happens between 45 to 55. But, the question is, do most women know when they're in menopause?
Yeah.
And so that's what I wanted to talk about today. And then there's this phenomena called menopause. Now, that's not a technical medical term.
Oh, okay.
But it's sort of a similar phenomena that happens in a middle-aged man's life.
Oh, okay.
Where you start to see an age-related decline in testosterone levels.
Oh, so that's not when they go buy a car? Like a red sports car?
Yep, that midlife crisis is part of it, certainly. Yeah. That certainly helps. But you start to see a lot of sort of similar symptoms to low estrogen that you would see in women, but you see them in men. So it's a transition phase for middle-aged people that kind of happens together for a lot of couples, and they don't realize it necessarily that they're both going through the same thing.
Yeah, and you're like, oh, I'm sweating, I have a hot flash. Yeah. And it's always terrifying for me because I'm not in it, but and then there's like the perimenopause or whatever, like when it's beforehand. And it's like, so this is something that I have a lot of friends that are going through it, and it's no joke. Like it can be. So what are some signs for a woman that she's going through menopause?
So first, most commonly irregular periods. So when you've gone 12 months without having a single period, basically that's how you diagnose menopause.
Okay.
Now you can also use fancy blood tests that are hormone tests to kind of help you. So if you think you're in perimenopause, but you're not sure because you're having hot flashes or some other symptoms, your doctor can actually check these tests. But the hot flashes followed by the cold sweats, that's a common symptom because our blood vessels are sort of freaking out a little as the estrogen goes away. So they start to have these types of changes. A lot of women will get weight gain. And they'll say, for some reason, I'm starting to put on a lot more weight than before. There's a lot of mood changes that go with menopause. And it's not necessarily every day. So it's kind of up and down. You have good days, bad days, irritability, fatigue, anxiety, depression.
Like we don't have enough to worry about.
Right.
It's so nice being a female, isn't it?
I mean, estrogen is so important, Jenny. And when we lose it, it can increase our cardiovascular risk as well. So I like to tell women menopause is a time to embrace as you're getting older. It's a life change, but it's also time to shift the focus on your health and your body because it's going through a lot. Yep. Estrogen plays a lot of roles in our body, and losing that estrogen can really have profound effects. So many women suffer alone in menopause, but really talking about it, talking about the symptoms, talking about treatments, that's the way to make menopause a better transition for us.
And how about menopause? Is it kind of similar in some of the side effects? Is it a side effect, a symptom? Symptom, there we go.
So basically what a man might feel is very low fatigue. And so a lot of men will start to say, I'm dragging. I had somebody in my office yesterday tell me that. Low libido. They'll have many of the mood changes as well. But you can also see a change for men, especially because of the testosterone in their muscle mass and the muscle distribution. And you can see that similar weight gain. Men don't get periods, and they don't really get the hot flashes because testosterone's not involved in that.
Yeah, why would they have to do any of that?
But if a man starts to notice he's kind of slowing down, getting more tired, feeling more irritable, it may be a midlife crisis, but it may also be menopause. And so it's something to talk to your doctor about whether it makes sense to check testosterone levels. Now, I generally don't recommend either for men or women hormone replacement therapy just for the sake of it. Yeah. Because our body is designed to see these hormones until our middle ages, and then they're actually supposed to go away. So by giving them back to people, men who've had cancer, prostate cancer, women who've had breast cancer, you could feed cancers, you could increase the cardiometabolic risk, you could increase risk of stroke. So you want to be really thoughtful. Don't just go to a naturopath and say, okay, I want some hormones. And you'll feel better with the hormones, right? Because these are anabolic steroids. Yeah. They help. Yeah. Everyone who gets testosterone feels more energetic. Yeah. But it doesn't mean you actually need it.
Okay. All right. That's good to know. Menopause. All right. I don't feel so bad. All right. I don't feel so bad.
Well, and you can now suffer together. Right?
Oh, and yay. This is why I'm going to be single my whole entire life. But it's Dr. Kohli. Thank you so much. Cherry Creek Heart now accepting new patients in Aurora.